What separates a trainee who is scoring pass compared to one who is scoring clear pass, Roger?
It's one of those things, I think that you know it when you see it. I don't know whether you're aware of how the exam is marked, but it isn't marked with a checklist. Did you do this, this, and this? Ideas tick, concerns tick, expectations no. It isn't marked like that. It's marked in a much more global, gestalt, kind of gut feeling kind of way. The examiners will be looking for three broad categories of quality. They'll be looking at data gathering. Do you get all the information that you need in order to work out what's going on? They'll be looking at your management plan. Is it sensible and safe and secure and well-informed? And they'll be looking at the quality of the consultation in terms of its fluency and its sensitivity and whether it flows and is patient-centered and stuff. And rather than having a checklist of items under those three headings, there'll be just four categories: clear pass, pass, fail, or clear fail. And there's no hard and fast regulations about how they make that decision. The examiner at the end will just be watching the consultation as a whole and just asking themselves, was the data gathering here done really skillfully and fluently and got most of the points? Clear pass. If the candidate got most things, but not everything, but actually the things that he didn't miss out weren't that important, pass. If the data gathering was a bit sketchy or erratic or not particularly skillfully done, or neglected to ask some things that are actually quite important, well, I'm afraid that's a fail. And if it went completely wrong, if it was a shambles, clear fail. And the same would apply to the nature of the management plan, and the interpersonal skills would be done in that very, very broad kind of way. And I think I would reassure people that when we're talking about pass fail, all that the examiners are looking for is to make a judgment: is this person ready to join the workforce? If the impression that the examiner gets is that this candidate is someone I'd be perfectly happy to see myself or for my relative to see, I think I'd be in safe hands with this doctor. Fine, that person is going to pass almost regardless of any minor blemishes that might be along the way, because we all make them. If, on the other hand, you get the impression that actually this doctor isn't quite really sufficiently on top of things, isn't sufficiently thoughtful, isn't sufficiently risk aware, or has a way of consulting that doesn't seem particularly interested in me, I wouldn't want to be doctored by this person, I'm afraid that person is going to fail, and probably rightly so.
Are you feeling unsure about the SCA? Maybe you don't know what to do, or you don't know whether you're doing the right thing? If you'd like to get a free copy of the SCA Blueprint, click the link down in the description below to get access to the SCA Blueprint that GP trainees have already used and passed the SCA exam. It's completely free. Just click the link down in the description below to get access to it.
In hospital, you can't really say that you've succeeded unless you've got a diagnosis and you know what the treatment is. That's the ideal. In general practice, we don't often make a diagnosis. When did you last make an actual diagnosis? I bet not that often. It's often probably this, could be that, might be the other, must make sure it isn't that. We're having to work with all sorts of uncertainties, and that's true in exam scenarios too. And often, even the management in general practice isn't as straightforward as it is in hospital medicine. We often have to temper ideal treatment with the reality of if a patient can't open bottles or is mildly confused or has got far too many tablets. We have to temper that. And so I think the difficulties that I've observed, understandably, with young doctors as they prepare for this new exam, is to try to get them out of the habit of trying to do a rushed hospital consultation in 12 minutes, because you can't. Instead, you have to try to divide that time of 12 minutes, which is the time that's available in an exam, and make sure you, to the best of your ability, cover that vital task of the consultation, which I mentioned when we first began, of first of all finding out what the problem is and then making a plan for dealing with it. And still factoring into that the uncertainties, the bits of information that might be unreliable, the fact that there's usually more than one way of managing a consultation. And for some candidates, I find it really hard to accept that there's no such thing as a perfect consultation in general practice. There's no such thing as perfect management. There's no such thing as complete understanding of the problem. We just have to do the best we can. But by way of reassurance, I would say to candidates like that the examiners who mark those cases, they live in the same real world too. They have to deal with uncertainty and don't always know what to do. So, word of reassurance, if any of Erwin's viewers are exam candidates, don't don't think that you're being judged by anybody who knows what the perfect answer is or are perfect themselves, because they're not. I'm no longer an active examiner, but I'm well in touch with my friends and colleagues who are. I know that they're not looking for anything particularly marvelous about it. All we want you to show the young doctors to show us is that you're safe. The patients are safe in your hands. You're not going to do them any harm, and that you can make your own decisions. Because unlike in most of the training grades, while you're still in training, there's always a trainer or a supervisor or a program director or someone that you can go to for advice. Once you've CCT'd and are out in the real world, that's no longer the case. So we're looking for a candidate in the exam to show us that they can keep their patients safe and that they can make and justify their own decisions. And how you do that, nobody minds too much. I've suggested a sensible way of approaching it, and that's what these books are about. But there's no right and wrongs about it. And so I think the question on which I've rambled for a number of minutes was what are the difficulties, or what advice would I give to people? I think the first bit of advice I would do is discipline yourselves to take 6 minutes of data gathering as best you can and then move on. Almost certainly, if you ask lots of open questions, just let the patient tell their story, ask a few well-chosen medical questions, you'll get a good enough idea about what the problem is to then be able to give 5 or 6 minutes worth of management. And if your aim is to pass the exam, if that's where you are in your career, and that's what you've got to do, the way to do it is to spend 6 minutes of data gathering and 6 minutes on management, and then you'll pass.
If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.